Today we're here with Jeannie. She's here for a consultation regarding possible facelift. Jeannie, can you tell us what the concerns are you have with your face and what particular things you'd like to improve upon?
The things on my face that I'm probably the most unhappy with would be my eyes and the lower part of my face. In my eyes, what bothers me are these sunken areas underneath my eyes that always look like I have dark shadows underneath my eyes. And then the little bit of frown lines, this horizontal line right here and a vertical line between my brows. I don't feel like I have a lot of crow's feet. If I do, they're not bothering me. What really concerns me is the sagging along my jawline. It makes me look like I'm frowning all the time, these lines right here. I do have lipstick bleed lines around my mouth. If I wear a dark lipstick, they'll bleed up. I'd like my lips to be a little bit fuller. They've gotten a little bit thinner as I've gotten older. And with my neck, the looseness underneath my neck, I feel like my neck kind of just blends up into my jawline, and that kind of, I feel, makes me look a lot older than I feel.
Can you show me your neck from the side?
Sure. See, there's no real angle here anymore. It all blends together.
What I would recommend for you, Jeannie, is a facelift and some fat injections. I'll explain how the facelift is done a little bit more. It'll be a dual plane facelift where we tighten up not only the skin but the muscle layer in the neck, underneath the skin, and also the layer under the skin in the mid-facial area. And then we're going to fill in some of those hollow areas and creases with some fat. The area under your eye, Jeannie, those hollow areas which you're concerned about, I'm going to add a little bit of fat close down to where the bone is, and that'll help smooth out that, what we call a tear trough deformity. Now, I know you mentioned the lines between your eyebrows in this region. Those can be helped with Botox. And you do have a little bit of mild ptosis or brows that are a little bit low, and I know you don't want a brow lift now. We can certainly do that at a later time.
Okay.
And then the facelift is going to lift this cheek area and pull it up more in a upward and lateral direction, and at the same time we'll inject some fat to fill in this crease we call the nasolabial fold. And then down towards your jawline, this crease that comes between your chin and your cheek, will fill that in with some fat also, in addition to lifting that cheek skin up and laterally. And the neck, you'll have a small incision underneath the chin, and we'll not only tighten the muscle down here, but we'll pull it behind the ear to help tighten that up and make a nicer angle underneath your neck so it looks more youthful in appearance. Do you have any questions about that, Jeannie?
Will I be able to go home the same day?
Certainly. We'll keep you for an hour or two after the surgery to let the anesthesia wear off, and you can go home that same day.
When do I come back and see you?
I like to see my facelift patients the next day and take the dressings off and examine everything, make sure everything looks fine, and then redress you, and then that dressing will stay on for another 2 days. And at that time you can take those bandages off at home and shampoo your hair. And we'll give you a garment, elastic type garment to wear around your neck and your cheek area, which will be snug fitting and helps decrease the swelling afterwards.
How much bruising can I, when can I go back out in public? About how long does it take for the bruising to go away? When can I start driving and wearing makeup and all, go about my regular life afterwards?
I'll take out some of the stitches in front of the ear and underneath your chin after 5 to 7 days, and at that time you can start putting on makeup. I wouldn't recommend driving for about a week.
Okay.
As far as the bruising goes, yes, you may have some bruising and it'll go through different stages of black and blue, and then fade to green, and then eventually yellow. And most of that swelling will migrate down underneath the skin and end up on your upper chest area.
When can I expect my final results? How long before I know how I'm going to look?
Most of the swelling will go down within the first month or 6 weeks. However, you will see some changes, relaxation for several months. The incision lines, the scars will be a little red, pink for a month or two, and those will eventually fade.
And the scars there'll be some in front of my ears as well as behind them, is that what you said?
Yes, you will have, and I can show you this. Turn towards the camera. The incision in front of the ear will come down around the top and go behind this little bump in front of the ear canal, and then come back and around the ear lobe itself and up into the back. So there will be minimal scars visible in front of the ear.
Okay. But you're not going to change my hairline any?
No, the incision on the hairline in front will go up to the top of the ear, and then it'll come forward and come along the hairline up here. If we made the incision back in the hairline and then pulled that skin backwards, you'd have more bald or non-hair-bearing skin too far back, and that looks unnatural. And the same thing goes for behind the ear. It'll be along the hairline so that we won't advance any non-hair-bearing area too far back. That looks like a telltale sign of a facelift also.
Sounds good.
Okay. We'll plan it this Thursday and proceed as we've talked about.
Sounds good. Thank you, Dr. Prophet.
You're welcome.